Alright, so today we are going to learn how to prepare a sterile tray for injection procedures. Most of the providers here have a standard tray that we like drawn up, and then from there we can make slight modifications that we would need depending on the procedure and the inject tape. So the first thing on our sterile tray prep setup is a checklist of all the things that we like on the tray. So we'll get out a sterile non-fenestrated drape. We'll get out our needles, which will include an 18 gauge 1.5 inch pink on the bevel, and then 25 gauge 1.5 needle, which is orange. We'll get out a 5 ml syringe for drying up anesthetic. Then depending on what procedure we're injecting, so if we're injecting small joints or 1 or 2 small joints, we can use a 5 cc syringe. But if we're going to be injecting a large joint, like a knee or a shoulder, a hip, or multiple targets, then we will use a 10 cc syringe, and maybe even more than one. But standard, we'll just have one 5 cc and one 10 cc syringe. Next, we'll have a chloroprep. We'll have a set of tubing, 4x4 sterile gauze, and a package of sterile towels. I think we got everything on the list. So before we start with preparing the tray, let's just talk a little bit about sterile protocol. So once we put the sterile drape on the tray, the area above and around that tray is going to be sterile. So we do our best not to cross the sterile field with anything that we're drawing up or any of our movements. And once we have created that sterile field, generally the outside lip here is considered non-sterile. But we try to avoid that as much as we can, but providers and everybody know that it is inside this area that is sterile. Because we do have to touch the corners of the drape in order to drape it properly. But once we have created that, if we accidentally touch it with non-sterile hands, if we accidentally, even if we've dropped all of our supplies onto the tray and the last supply corner of the packaging hits the tray, you have to start over. And it's really important that you are diligent about that, because that sterility is the provider's license. If they get an infection based on that tray, it's the provider, and so they have a lot of trust in you that you're doing all this sterilely, and trust that if you don't do it sterilely, it's okay. It'll take 5 minutes to drop a new tray. You're not wasting too much product. Don't worry about that. The sterility is going to be the most important thing. When we open this tray and we're providing an injection into a joint, we're assuming that everything is perfectly sterile and that we're not going to have any complications. The biggest risk within a joint injection would be infection. So this is the best way to mitigate that. Okay, so to start out, we will open the sterile towel, sterile drape. A lot of people have different tricks about how to do this. Some of those things you can kind of figure out on your own, but one thing I've seen is now that this is open, the inside is sterile, you can grab it like that and then finish pulling here. So now it's still completely sterile, but the corners we will need to touch. You just let it drop. And there's a front side and a back side. The back side has, you can see the taping along the barrier here. That's going to be the bottom side that's not sterile. So if you open it up from the back side, again, you're just touching the corners. Let it fall, then let it fall in the tray. Okay, so there's our sterile field, except for this little barrier around the outside. Now next, whatever order you'd like to drop your supplies on the tray, that's fine. You're going to organize them at the end. Again, knowing that these packaging are not sterile. It's what's inside of it that's sterile. Your hands are not sterile. Your breath isn't sterile. If you have a beard, you should be wearing a mask. These syringes, these packaging, sometimes they are difficult to tear open. And if you tear them and they don't tear complete, and you have the syringe, the outside of the syringe touching the outside paper packaging, and it drops on the tray, neither one of that's not sterile anymore. You gotta try again. So again, try not to open it directly over the tray, but begin opening it on the side of the tray. See how that one is tearing down there? So what I'm going to try to do is pop it out as I go. So now it's not touching, it's still only touching the inside. And drop it like so. That one opened a lot easier. ChloraPrep will have a little paper in the container in the sterile field. That's okay, it's sterile. You can just drop it on there. Same thing as the syringes, the needles. Sometimes the paper backing doesn't tear very good. And the needles can tend to wiggle a little bit. If they touch your finger, it's done. You got to start to hold the tray. The sterile towels are a little tricky because the towels are covered with this outside paper. So we just pull back here, and drop like so. The inside of the paper is sterile, the outside is not. Okay, so now we have all of our supplies on our tray. The next step is to prepare the medications for drawing them up. For the anesthetic, as standard, we will use 2% lidocaine with sodium bicarb. Always check the labels. They should have a date of when they were opened and first used. If they don't, we don't know when it was, we don't know when it expires, so you have to get a new bottle. Okay, so these both, and they're good for 1 month. So these are both okay. So we'll set those down on one side. Most often the trays that we'll be drawing up and asking for will be a dextrose and dexamethasone injection. Sometimes if we want to do a moderate dose steroid, like a 20 milligram of depomedrol or 40 milligram depomedrol, more like a full dose steroid, we'll specify that, but that'll be the rare occasion. So today we'll demonstrate the standard dextrose and dexamethasone injection. It's important to get the concentration of the dextrose right. Some targets will be doing a 5% dextrose, some targets will be doing a 12.5% dextrose concentration. That'll be important a little further down the line. But to start out, in our dextrose and dexamethasone solution, we have dexamethasone, 100 milligrams per 10 milliliters. We're going to be using 0.5% ropivacaine, or Nerapin, excuse me, and normal saline, sterile. The last ingredient is the dextrose. Now, there's two ways to obtain the dextrose. This dextrose is from a bag in Procedure 1. That dextrose bag is 40% dextrose, okay? And it's in here in a sterile syringe. Now, there's also 50% dextrose, 25 or 50 milliliter bottles. Now, depending on if you're using a 40% concentration dextrose or a 50% concentration dextrose, that's going to change the volume you draw up in order to get a 5% concentration or 12.5% ending concentration. The sheets that we have in the procedure rooms are based on the 40% dextrose bag. So they are based on this procedure. When we get more of the 50% dextrose bags, we'll have those inserted as well. But these are guidelines for how much to draw up depending on if you're doing 5% dextrose and dexamethasone, either 5 cc's or 10 cc's, 12.5% concentration, 5 cc's, 10 cc's. On the back, sometimes we won't want any dexamethasone. So then that's the volumes for just 12.5% dextrose or 12.5 or 5% dextrose. So this will be a handy guide that is on the counters in the procedure room. Okay, so we've got our medicines organized here. For the dextrose, we just remove this little cap. We have a transfer here so that we can transfer it sterilely between syringes. I like to keep my anesthetic syringe on one side and my injectate syringe, the therapeutic syringe, on the other side. So next what we do is make sure we clean the tops of each of these bottles with alcohol. I like to clean this as well. You just set that like so. And then we get a single sterile glove. They come in these blue packages. There's a large and I think we have small. And in here, the small are behind in the cabinet. So you have a large or a small. Pick whichever fits you best. So we'll open this up, and what this will do will allow us to interface between the sterile tray and our non-sterile bottles. So you just fold the corners, pull it here, make sure you don't touch within the sterile area. Get your fingers in here. So this side of the cuff is going to be onto the non-sterile palm, so it's okay to touch there. And you just position your fingers. And then reach a little higher, grab a fold, and pull down. Okay? So now this, if it touches anything that's not sterile, and you touch the tray again, you gotta start over. If you touch something that's not sterile, but you don't touch the tray, just take it off and get a new glove. I like to take this paper off, just put it on the side, and kind of organize the tray a little bit. So to start, we'll start with drawing up the anesthetic first. So use your gloved hand. I like to brace the syringe with the hypothenar eminence here. Grab the 18 gauge needle and then you'll connect it to your sterile syringe. Uncap the needle. Be careful to use good sharp skills and don't poke yourself. Then we'll come over and use the 2% lidocaine. Our standard mix is going to be 4.5 cc's of 2% lidocaine. Okay, draw that up with 0.5 cc's of sodium bicarbonate. Okay, and then to recap the needle, we just leave the cap there, start inserting the needle, tip it up, close the needle, unscrew. Now we have our anesthetic drawn up. To indicate to the provider that it's anesthetic and not the therapeutic syringe, we put on the 25 gauge orange needle. So that's just standard protocol that all the providers will know this one is the one with the anesthetic. Now we move on to drawing up the dextrose and dexamethasone injectate, or the therapeutic syringe. With this one, we start with the dextrose because the dextrose doesn't require the 18 gauge needle. We have the transferred from that syringe to this syringe. Again, this is sterile. This one is not, but the injectate inside is sterile. You just connect there, tip up, use your sheet. So this is a 10 cc volume syringe, and we're doing a 12.5% concentration of dextrose dexamethasone, which means we'll drop 3.1 of the 40% dextrose. Okay, I like to bring it down a little bit because if you leave it all the way to the top, it might leak a little bit when you put it back down on the tray. We like to keep the trays nice and dry if we can. Again, this time we're going to put on the 18 gauge needle to drop the rest of the injectates. Same technique that we used on the anesthetic. When we're drawing up for therapeutic injections, we save the steroid for last because we don't want to contaminate steroid and any of the other things. Use good drawing up techniques so that you don't contaminate vials. The way to do that is to leave yourself a 1 cc buffer at the top. And then you know, okay, I have 3.1 in there and I want to draw up